Welcome to Evergreen Health Tips. Today we're going to bring to you the importance of regular checkup to avoid rare diseases and what they actually are. Outline asterisk. 1. Introduction to rare diseases. Definition and prevalence. Importance of awareness. 2 challenges in diagnosing rare diseases. Diagnostic delays. Lack of specialized knowledge. Misdiagnosis and underdiagnosis. 3. Diagnostic tools and techniques. Genetic testing, imaging and laboratory tests. Role of patient history and symptomatology. 4. Examples of rare diseases. Cystic fibrosis, Huntington's disease, Ehlers-Danlos syndrome, Gaucher disease, Fabry disease. 5. Current research and future directions. Advancements in genetic research. Personalized medicine. Role of technology in diagnostics. 6. Patient support and advocacy. Importance of patient organizations. Global and local resources. 7. Conclusion. Summary of key points. Call to action. Introduction to rare diseases. Rare diseases, as the name suggests, are conditions that affect a small percentage of the population. According to the World Health Organization, WHO, a disease is classified as rare if it affects fewer than 1 in 2,000 people. Despite their rarity, these diseases collectively affect millions of people worldwide. There are over 7,000 identified rare diseases, and they pose significant challenges not only to those diagnosed, but also to healthcare systems globally. Understanding rare diseases is crucial because it fosters awareness, drives research, and helps improve patient outcomes. One of the main challenges surrounding rare diseases is the difficulty in obtaining a correct diagnosis. On average, it takes about 5 to 7 years for a patient to receive a proper diagnosis after the onset of symptoms. This delay is due to several factors, including limited medical knowledge, the rarity of the conditions, and the often complex nature of symptoms that can overlap with more common diseases. Challenges in diagnosing rare diseases. Diagnosing rare diseases is fraught with challenges, primarily due to their uncommon nature. Many healthcare professionals may never encounter a particular rare disease in their entire career, leading to a lack of awareness and experience in recognizing these conditions. Additionally, the symptoms of rare diseases are often nonspecific and can mimic more common illnesses, leading to frequent misdiagnosis. Patients with rare diseases often endure a diagnostic odyssey, where they visit multiple specialists, undergo numerous tests, and receive incorrect diagnoses before the correct one is finally identified. This journey can be emotionally, physically, and financially draining for patients and their families. Diagnostic tools and techniques. Accurate diagnosis of rare diseases often requires a combination of approaches, including genetic testing, advanced imaging techniques, and detailed patient history. Genetic testing has revolutionized the diagnosis of many rare diseases, especially those with a hereditary component. Next-generation sequencing, NGS, allows for the examination of multiple genes simultaneously, increasing the chances of identifying a genetic cause for a patient's symptoms. In addition to genetic testing, imaging techniques like MRI, CT scans, and specialized laboratory tests play a critical role in diagnosing rare diseases. These tools help in visualizing abnormalities that may be characteristic of certain rare conditions. A detailed patient history, including family history, can also provide crucial clues that lead to a diagnosis. Examples of rare diseases. 1. Cystic fibrosis. Cystic fibrosis is a genetic disorder that primarily affects the lungs and digestive system. It leads to the production of thick, sticky mucus that can cause severe respiratory and digestive issues. Early diagnosis through newborn screening and genetic testing has improved outcomes for patients with this condition. 2. Huntington's disease. Huntington's disease is a neurodegenerative disorder caused by a mutation in the HTT gene. It leads to progressive brain damage, affecting movement, cognition, and behavior. Genetic testing is key in diagnosing Huntington's disease, particularly in individuals with a family history of the condition. 3. Ehlers-Danlos syndrome, EDS. EDS is a group of disorders affecting connective tissues, characterized by hypermobile joints, skin that bruises easily, and a tendency to develop scars. The condition is diagnosed through clinical evaluation, genetic testing, and sometimes skin biopsy. 4. Gaucher disease. Gaucher disease is a lysosomal storage disorder resulting from the deficiency of the enzyme glucocerebrosidase. It leads to the accumulation of fatty substances in organs, particularly the spleen and liver. Enzyme replacement therapy has been a significant advancement in the treatment of this disease, and genetic testing aids in diagnosis. 5. Fabry disease. Fabry disease is another lysosomal storage disorder caused by mutations in the GLA gene, leading to a deficiency in the enzyme alpha-galactosidase. It causes a wide range of symptoms, including pain, kidney dysfunction, and heart issues. Early diagnosis through genetic testing is crucial for managing the disease. Current research and future directions. Advances in genetic research and technology are paving the way for better diagnosis and treatment of rare diseases. The rise of personalized medicine, which tailors treatment based on an individual's genetic makeup, holds great promise for patients with rare diseases. Additionally, the use of artificial intelligence, AI, in analyzing large data sets can help identify patterns that lead to faster and more accurate diagnoses. Patient support and advocacy. Support groups and patient organizations play a vital role in the lives of those affected by rare diseases. These groups provide information, emotional support, and advocacy for patients and their families. They also work to raise awareness and funds for research, contributing to the global effort to improve the lives of people with rare diseases. Conclusion. In conclusion, rare diseases, though individually uncommon, affect millions of people worldwide. The challenges in diagnosing these conditions highlight the need for greater awareness, education, and research. By advancing our understanding of rare diseases and improving diagnostic techniques, we can hope to reduce the diagnostic odyssey and improve outcomes for patients. Remember, by sharing knowledge and supporting initiatives, we can make a significant difference in the lives of those affected by rare diseases. For more information on health-related topics, don't forget to like, subscribe, and share this content with your network. Your support helps in spreading awareness and bringing crucial information to those who need it. Stay informed and healthy with evergreen health tips.